Chagas disease, also known as American trypanosomiasis, is a parasitic infection that affects millions of people, primarily in Latin America. Chagas disease occurs when a person is infected with a parasite called Trypanosoma cruzi, which typically enters the body through the bite of an insect known as the triatomine bug or the kissing bug. These bugs are nocturnal and often bite humans while they sleep, typically around the face or mouth. That's why it has that nickname. After the insect bites and feeds on the person's blood, it defecates near the bite wound. The parasite is present in these feces, and when a person unknowingly scratches or rubs the area, the parasite enters the body through the wound or through mucous membranes like the eyes or mouth. Once inside the body, T. cruzi begins to replicate and spread, leading to the development of Chagas disease. These blood-sucking insects are found primarily in the Americas, ranging from the southern United States to northern Argentina. They tend to live in cracks and crevices of poorly constructed homes, particularly those made of mud, thatch, or adobe. The prevalence of Chagas disease is quite significant, with the World Health Organization estimating that 6 to 7 million people worldwide are infected with Trypanosoma cruzi. The vast majority of these cases occur in Latin America, where the disease is endemic. However, due to increased global migration, cases of Chagas disease are now being reported in non-endemic areas such as North America, Europe, and some Western Pacific countries. Causes of Chagas disease. The most common route of transmission is through the bite of an infected kissing bug. However, it's not the bite itself that transmits the parasite. The parasite is present in the bug's feces and enters the human body when the person unknowingly rubs the feces into the bite wound, their eyes, or mouth. Once inside a human host, the parasite invades cells and transforms into another form called amastogotes. These amastogotes replicate within cells, particularly in the heart, digestive system, and nervous system, causing the cells to burst and release more trichomastogotes into the bloodstream, where the cycle continues. This ongoing destruction of cells and tissues leads to the symptoms and complications associated with Chagas disease. While this way of transmission is the most common route, there are other ways to contract Chagas disease. These include congenital transmission from an infected mother to her baby during pregnancy or childbirth. Another way to get the disease is through blood transfusions or organ transplants from infected donors, and rarely through the consumption of food or drink contaminated with triatomine bug feces. Symptoms of Chagas disease. The symptoms of Chagas disease can be quite varied and occur in two distinct phases, the acute phase and the chronic phase. The acute phase occurs shortly after infection and can last for a few weeks or months. Surprisingly, many people don't experience any symptoms during this phase, or if they do, the symptoms are mild and nonspecific, resembling those of many other illnesses. When symptoms do occur in the acute phase, they can include fever, fatigue, body aches, headache, and a loss of appetite. Some people may develop a characteristic swelling around the eye called Romane's sign, which occurs when the parasite enters the body through the eye. Others might notice a skin lesion or a swollen red area at the site of the bug bite. One of the unique aspects of Chagas disease is that after the acute phase, the infection enters a prolonged asymptomatic period known as the indeterminate form of chronic Chagas disease. During this time, which can last for decades, a person may feel perfectly healthy and be unaware they're infected. However, the parasite remains in the body, slowly causing damage to various organs, particularly the heart and digestive system. Eventually, about 20 to 30% of infected individuals will develop the symptomatic chronic phase of Chagas disease. This phase can manifest in different ways, but the most common and serious complications involve the heart. People may experience irregular heartbeats, heart failure, or sudden cardiac arrest. These symptoms can feel like shortness of breath, especially during physical activity, fatigue, dizziness, and chest pain. In some cases, Chagas disease affects the digestive system, leading to enlargement of the esophagus or colon. People with these complications may experience difficulty swallowing, severe constipation, and abdominal pain. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of Chagas disease. Diagnosing Chagas disease can be challenging, particularly in non-endemic areas where doctors may not be familiar with the condition. The diagnosis typically involves a combination of clinical assessment, considering the patient's history of potential exposure, and laboratory tests. In the acute phase, diagnosis is usually made by detecting the parasite directly in a blood sample under a microscope. However, this method becomes less effective as the infection progresses and the number of parasites in the blood decreases as more and more of the parasite are transforming into mastigotes. For chronic Chagas disease, diagnosis primarily relies on serological tests that detect antibodies against Trypanosoma cruzi. These tests include enzyme-linked immunosorbent assays, indirect immunofluorescence assays, and indirect hemagglutination assays. Because no single test is considered sufficiently sensitive and specific, the World Health Organization recommends using at least 2 different serological tests to confirm a diagnosis. In some cases, particularly when heart involvement is suspected, additional tests may be necessary. These can include electrocardiograms to check for heart rhythm abnormalities, chest x-rays to look for an enlarged heart, and echocardiograms to assess heart function. Treatment for Chagas disease. Treatment of Chagas disease depends on the phase of the infection and the severity of symptoms. In the acute phase, anti-parasitic treatment is highly effective and can cure the infection. The 2 primary medications used are benznidazole and nifurtimox. These drugs work by killing the Trypanosoma cruzi parasites in the body. Treatment is most effective when started early in the course of infection. For this reason, all acute cases, congenital infections, and infections in children should be treated. The treatment course typically lasts 60 to 90 days and can have significant side effects, including skin rashes, digestive issues, and neurological problems. In the chronic phase, the decision to treat with antiparasitic drugs is more complex. Treatment is generally recommended for children and adults up to age 50 who are in the indeterminate phase or have early cardiac or digestive involvement. However, for older adults or those with advanced heart disease, the benefits of treatment must be weighed against the risks of side effects. For those with chronic Chagas disease who have developed complications, treatment focuses on managing the specific problems. This might include medications for heart rhythm abnormalities, pacemakers for severe heart conduction problems, or even heart transplantation in cases of severe heart failure. For digestive complications, treatment may involve dietary changes, medications to aid digestion, or in severe cases, surgery to correct megaesophagus or megacolon. Prevention of Chagas disease. Prevention plays a crucial role in controlling Chagas disease. In endemic areas, efforts focus on vector control through the use of insecticides, improving housing conditions to make them less hospitable to triatomine bugs, and using insecticide-treated bed nets. In non-endemic areas, prevention largely involves screening blood donors and organ donors to prevent transmission through transfusions or transplants. Pregnant women from endemic areas should also be screened to prevent congenital transmission. At the end, despite all these challenges of the disease, many people with Chagas disease lead normal, healthy lives, especially if the condition is diagnosed and managed early. Now we want to hear from you. Do you or someone you know have Chagas disease? What treatments did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.